IPL treatments stand for intense pulse light. These are machines that emit strong beams of light, of visible light actually, that are in the range of 500 to 1200 nanometers in wavelength. There are quite a few IPL machines out there. I find Limelight offers me the greatest flexibility when I'm treating certain conditions. I can actually shift the beam towards one way to treat reds more effectively, or I can shift the light spectrum the other way to treat browns more effectively. So IPL is very good at treating the skin texture, giving you more glow and evening out the skin tone. It's very good at treating superficial reds and browns. So that would include freckles, that would include sunspots, small dilated blood vessels, and even rosacea. Because of the great flexibility of IPLs, some spas will purchase one IPL and use it to treat everything. So that for hair removal, they'll use that machine. For veins, they'll use that machine. For skin tightening, for lightening, for cellulite even, everything is treated with one machine. So I don't think that's necessarily a great idea, because you're really taking that machine out of its sweet spot. So all machines are designed for a certain function, and while it's slightly effective out here, to me it's far better to use a laser that's specifically designed for that purpose. With melasma, I'm always very cautious. IPL can be effective in some types of melasma, but they can also make other types of melasma worse. So for that reason, I'm very hesitant to treat melasma with IPL, because there are other safer, more effective treatments for melasma. With IPL, after treatment, you'll find that your lesions will actually darken for the next day or so, and then over the course of 4 or 5 days, these darker lesions will slowly flake off. It's nothing that can't be covered up by some foundation or by some makeup, and so most clients don't tend to take a lot of time off work for that. With an IPL, it's a long treatment again, and so it feels like a rubber band snapping, and that's not a bad thing for the first 5 or 10 minutes. Eventually, after about an hour or so, and together with a bright flash, a lot of patients will find it rather annoying, and so for that reason we'll actually put a bit of topical anesthetic on there and leave it on for about an hour to make that treatment as sort of pleasant as possible.